Hi everyone, and welcome back. Today we have a special guest for you here today. It's Amanda Williams. Amanda, thank you very much for being with us here.
Pleasure, absolute pleasure.
So let me just give you a little bit of background on Amanda. So Amanda is an internationally experienced integrative naturopath and medical herbalist. Amanda has over 20 years of clinical experience in practice. She specializes in integrative endocrinology for women. Amanda has dedicated her clinical practice to discovering and addressing the underlying cause of ill health to deliver long-term sustainable health solutions. So I got a question for you, because she did the presentation just a little while ago talking about how they take the different herbal products, basically going from seed to clinic. And I hear this question all the time, and I want you to address this for a minute. It's like, patients will come to me and say, well, Dr. LeMay, why do I need to get St. John's wort from you when I can just go over to Costco and get it there?
Well, that's the perfect question, isn't it? And I get this all the time in my own clinical practice in Brisbane, Australia, because we have patients that come in maybe for the first time and they bring all their supplements that they have at home, and I then go through all of those supplements and explain why what I use as a professional and a specialist in particularly herbal medicine and naturopathy, why what I choose is so particular, because I obviously investigate the companies. I want to understand what quality parameters they put into place, what geniuses in terms of their scientific people and their laboratory facilities, etc. Because just because something might be St. John's wort, it isn't necessarily St. John's wort that's going to confer those clinical effects to alleviate mood, work as a superb antiviral as well. And so if we use St. John's wort as an example, there are many what we call phytochemicals, so constituents or compounds in the plant that work together to give it its clinical results in the body, i.e. helps you feel better. And so if we think about St. John's wort, many products that you might see in GNC, as you mentioned, or other stores, they will have something marked on the label which is called Hypericin. Now, Hypericin is one of these many plant compounds that can give a result in terms of alleviating mood, making you feel happier. However, it requires other compounds within the plant to make sure it is what we call bioavailable. So therefore it gets into the bloodstream and then is able to do that job. And those things are called flavonoid glycosides. Now, I know all of this sounds quite scientific, etc., but I just want to assure you that there is a number of compounds. So there's flavonoid glycosides, there's something called hyperforin. So there's all these different things in plants, and that's why we need plant experts, herbal experts, who research these plants to understand what is it that works within the plant to ensure that we get the great results in our bodies and for us as clinicians with our patients. And unfortunately, plants are very complex. And I've mentioned a number of things in St. John's wort, but that's certainly not the complete picture for St. John's wort. And if we go on to look at all the other plants that we use, the botanicals, they're incredibly complex. They have an amazing ability to work very effectively in the body. They have an evolutionary ability to be really integral with our body's chemistry. So we call that pharmacognosy in terms of how it works within the body. And in order to ensure that we can have the best quality, it starts with the herbal farmer. And I choose to use MediHerb because in my clinical practice, I've seen better results from MediHerb than I've seen with any other products I have used in terms of herbal products. And MediHerb works with those herbal farmers. They have a specific team of people that actually go out and visit farmers all around the world. They develop these amazing relationships that span back over 30 years to ensure that we get not only the best quality, but we have a sustainable supply. Because as we all know, being a farmer and working in agriculture is incredibly difficult these days. And so, with the climatic conditions and the variability, we need to ensure that we have a sustainable livelihood for our farmers, and in particular our herbal farmers, and that we source the best quality. Additional to that, there are a lot of companies, big companies, that sell herbs, in terms of raw herbs, to companies that then manufacture herbal products. And unfortunately, some of those companies aren't as ethical, and so we get very poor quality products. And an example I used in my discussion today, my presentation, was one herb that is often substituted with another, and that's the herb skullcap. And it's often substituted with another herb called tucrium, because it's much cheaper to grow, and that's called economic adulteration. But unfortunately, this herb called tucrium is actually toxic to our liver and actually can kill you. So these are the things that we're talking about in terms of, it's not just about quality and about making sure that you are getting the right quality to have the clinical outcomes, but about them being safe, and we don't know what we're buying. And in that example with skullcap, there was the US Department of Agriculture sourced skullcap products from the internet in the United States, and they found over 40% of them were not actually skullcap, and that they were substituted with another herb. Now that's dangerous.
That is dangerous. So it's like, and correct me if I'm wrong on this, but it's like, if you're going to make a cake, like a chocolate cake, you want to make sure you have all the right ingredients. And if you don't have all the right ingredients, you may end up with, pineapple upside down cake versus a chocolate cake. And that's kind of like what happens with herbs in the United States today, because I always compare herbs in the United States as like the wild, wild west. We do anything here and call it, skullcap or something like that. But you go to Australia, and that's the one thing that really impressed me when we visited MediHerb there, is all the herbs and how well they check them. When you go there and you see how well they check everything, it's amazing. It's just like, I always tell, it's like I compare these guys to like Disney World. It's like going there is like Disney World. They're that good at what they do. It's like the happiest place on earth.
Well, MediHerb's the most herbal place on earth, right?
There you go, the most MediHerb place on earth. Yeah, herbal.
Yeah.
So could you give us an idea, like say like because we're talking about this, why don't you give us do you have a case study that you can kind of explain, like why are the herbs so good?
Yeah, well, I think I'll use some of the, one of the cases that I just spoke about in my presentation, where I had a patient, he was a non-patient when he actually had a very severe fall and did an incredibly complex injury to his wrist.
Yes, that was a good case.
Yeah, so this particular injury is called a scapholunate ligament tear, which I know sounds bizarre, but
he hurt his wrist.
He hurt his wrist very, very badly. And he went in for very complex surgery, had the surgery, wires, pins, and a transplant of a ligament, essentially. And he started taking the drugs that are typically prescribed post-surgery, things like tramadol and oxycodone. And his wife called me the next day, who is my patient, and she asked me to help him because he was not finding the drugs were working effectively enough, and also he was he was very angry and irritable.
Not a happy camper.
Not a happy camper, exactly. So he then said to me, botanicals will not work to relieve my pain at all. I'm in acute pain, and he was quite irritable and angry with me on the phone as well in the consultation. Needless to say, I ignored him completely and prescribed the botanicals.
Good job, doctor.
Yes, exactly. But prescribed the botanicals that I know work, and some of those are nervogesic, and also I find the Boswellia complex, the turmeric forte, and the Gota Cola complex can be incredibly beneficial among some of them because they have amazing healing and pain relieving abilities.
They do.
And he, within 6 hours, he phoned me back and he said, I can't believe how well these herbs are working and how much my pain has dissipated. So he was then a convert from then on, and needless to say, he had multiple surgeries. using only the herbs, no drugs, and he's had amazing recovery. So, I've got countless cases like this where herbs are incredibly powerful if used in the right way, and that's why you need to see your health professional as well and not self-diagnose and self-treat, because you will make the mistake of not choosing the right things and you actually waste a lot more money. You really do. I've had patients that bring copious amounts of bags of supplements to my practice in the first consultation, and a lot of it is trash, and we actually throw it in the trash. So you do need to consult with your health professional, the wonderful Mark, for example, and make sure that you are getting the right care, the very precise, accurate care that you need. And that's why we're all here attending seminars, investing our own personal time to learn all the time. It never stops, so that we can be the experts and help you, rather than you trying to find the information maybe on the internet and then not necessarily choosing the right supplements, or not necessarily getting the right quality supplements, maybe even a combination of the both, which is most common.
Well, Amanda, I can't thank you enough for sharing with our viewers here all this great information, because again, this is what you need to hear, because it's like we don't just go looking for any kind of like skull cap or all the different herbs that we have. We're looking for the best, and we've got them right here. So Amanda, thank you again very much for
Thank you.
speaking to our,
thank you everyone,
and we will see you next time.